I'm Annika. I'm Dr. Alizadeh's nurse here at Cosmoplastic Surgery. I'm here today to talk to you about the Jackson Pratt drain, or JP drain. We do use the JP drains for a few of our procedures. For example, tummy tucks, breast reconstruction surgeries, migraine surgeries. So it's important to know how to care for them. The drain usually stays in for about 7 to 10 days, then they get removed, and I will show you today how to care for it for those 7 to 10 days. So this part here simulates where the drain comes out of your body. There is sutures to hold this drain in place, so you don't have to be afraid of pulling the drain out with what we're going to do now. What I want you to do is take 2 fingers, hold a tight grip to the tube, use your other hand, and you're going to slide it down and pulling and pushing the fluid forward towards the bulb. And you're going to be moving along the whole tube, and you're going to see the blood moving, and if there's any clots, they will move towards the bulb. And you're going to do this all the way till we get down to the bulb. Sometimes it's a little hard to slide the fingers. You can use a little water to make it a little easier to glide down the tube. You're going to keep going, and you're going to see the fluid coming down to the bulb. Then when you're done with that, as you see, now we have a nice flow here because there's no blood clots clogging any tubes. I would like to do this at least twice every time you empty the drain. So every 6 to 8 hours is when you should be doing this. And again, you're going to take a nice grip close to where the tube comes out. It's sutured in, so don't be afraid of really milking this tube. Again, you're going to slide it down by compressing your 2 fingers and pulling down the tube. Just going to milk this tube to make sure we're moving that fluid towards the bulb. When you're done with this, at least 2 times, but if you see blood clots, it might be a 3rd or 4th time till you have no blood clots anymore. Fluid you will see, but we want no more blood clots. And even if you have no blood clots, we still want you to milk that too, 3 times a day a minimum. Once you're done with that, you're going to open this little cap that we spoke about, open that up, and the bulb is actually graduated on the side. I'll see where I can find, there it is. It says 25, 50, 75, and 100. You go, if it's between 50 and 75, give me as close of a number as possible. 50 or 75 is fine. This is a guideline for us to see how much fluid you have. When you're done with measuring it, I want to know the color of it and the amount, and you write that down for me. Then you're going to take the bulb, you're going to turn it over. You can empty it into a sink, a cup, whatever you're comfortable with. So you're going to squeeze the fluid out through the hole where the cap is. When you're done with that, you're going to take the bulb, you're going to really squeeze it together. Make sure most or all the air is out of the bulb as much as you can. Really squeeze it together. Then you're going to recap it, which causes that negative pressure flow. So it pulls the fluid from under your skin into the bulb again. It's very simple, and you will get used to it after doing it one time.